Good morning, everyone. Thanks for logging in for our second Best Fit class. Uh, Topic this week is Heartstrong Fitness for Cardiovascular Health. This is our second class in the Best Fit series. Best Fit series is designed to get you guys active, get you guys moving. Really interested trying to promote exercise and physical activity for health and wellness and longevity. In this class specifically, we're trying to improve our cardiovascular health and fitness. Again, whether we're new to exercise, looking to get back on track. Today, we're just going to spend some time talking about what is cardiovascular health, why is it important, and some simple strategies to increase our daily activity, break through any barriers. Again, hopefully find a routine, activities that we enjoy and that work for you. Before we get started, though, I do want to introduce myself. My name is Ryan, part of the Best Health team. I'm a well-being specialist on the Best Health team. Been here with Baptist for about 6 years, a little over 6 years. Really have a true passion for exercise, also for health promotion, right? So really want to encourage everyone to live a long and healthy life through healthy habits, exercise being one of the fun ones I really enjoy talking about. So really, again, really look forward to working with everyone to achieve their exercise goals or activity or movement goals, and along with achieving their health and wellness goals and staying healthy long term. Before we get into this class topic, last time, all the way back in last fall, we had our first Best Fit class. Just wanted to spend a little bit of our time just recapping that last class we had. You always go on and watch the recording if you're interested. Our topic was Move More, Live Better, a practical guide to getting active. The whole gist of that class was to move more and to stay active. But within those main topics, right, with moving more, just encourage people to start small. But we don't have to set large goals right off the bat. We don't need to go from 0 to 100 immediately. We can take some time to build up our activity, to build up our movement goals or exercise goals. Right, we want to start small and slowly increase our exercise time, slowly increase our intensity up until we're meeting those key physical activity guidelines. Hope you guys remember those as well. Right, trying to get 150 minutes a week of moderate intensity aerobic activity, which we'll talk more about today, and 2 days of strength training. Right, we want to build up to those key physical activity guidelines. Also want to think about trying to move more. Can we build it into our day? What are we already doing that we can take a couple extra steps, be a little more active? Obviously, little simple things like parking farther away at work or at the store. We can get in some more steps, taking a little walk break after a meal, during a break at work. Can we go ahead and schedule it? I think that can be great. Can we go ahead and put it on our calendar so we get some reminders? It's already on our calendar, so we don't have to make time later. But also, again, think about what you're already doing, right? Maybe we're taking the kids to a sporting event after work. Maybe we can go walk around the baseball fields if we're taking our kids to a baseball game or baseball practice later. Maybe we can walk while they're doing their baseball practice. Lastly, with moving more, find with what you enjoy. It's going to be so much easier to be consistent over the long term, right? Again, we want to make these sustainable habits, lifelong habits around movement, around exercise, around activity. If we truly enjoy it, it's going to be so much easier to get to the gym or to get in those steps. So again, it doesn't have to be on the treadmill, it doesn't have to be in the gym. Right? Can we get outside? I put that there because that's one of my favorite things to do. Getting outside, especially when it's nice and sunny outside. Can get some nature therapy. But whatever you might enjoy, right? Again, if it's an online exercise class, is it in-person exercise class at the gym with your best friend? Is it following a YouTube video early in the morning? Is it taking your dog for a walk? Whatever you might enjoy. And lastly, kind of covers just some practical steps with staying active, finding some fun ways to kind of track your progress, kind of gamifying the progress a little bit with things like fitness trackers, fitness apps, fitness challenges, where we're kind of gamifying things. We can see what we've been doing easily, see how our friends are doing. Maybe can we do better than them? We do better than ourselves last week, I think is probably more important. Right? Again, slowly building up that intensity, slowly building up that volume. If we did, let's say 7,000 steps per day last week, can we shoot for 7,500 this week? Something similar to that, kind of pushing ourselves. Also, again, really want to progress gradually. Just as I just mentioned, can we continue to be a little bit better, include more time, more intensity, take our fitness to the next level? There's lots of different measures. Are we looking at muscular strength, other muscular fitness? We're looking at cardiovascular fitness. Maybe it's balance, flexibility, lots of things we can measure and continue to progress. Again, just keep it simple, find activities to love. Again, it's never too late to start being active. That's what we covered last time, but with this class, just want to start off with a little pop quiz. Question number 1 is, how many minutes of exercise do you think it takes to start improving heart health? So this is a little bit of a trick question, because again, we want to remember those key physical activity guidelines for Americans that we mentioned. Right, if we're getting 150 minutes of moderate intensity aerobic activity, we can see significant improvements in our cardiovascular health. Right, so that's kind of the guidelines. But we could also say, this is a little bit of a trick question, right? Because I could say, bounce up to as short as 10 minutes can start to improve our health, right? So again, any little bit of increase in activity, decrease that sedentary time, we start to see heart benefits. Again, if we're meeting those key physical activity guidelines, we're really going to see some heart health benefits. Number 2, what is the single most important job your heart does every day? A little bit less of a trick question. On number 2, the answer is pumping blood to deliver oxygen and nutrients to our entire body and removing waste products like carbon dioxide. We're going to be able to remove some of those waste products, right? Again, we're just trying to pump blood to those tissues that need oxygen, to need nutrients, remove any of those waste products, doing that all day long, while we're exercising, while we're sedentary as well. Number 3, true or false? Regular exercise can lower your resting heart rate by up to 20 beats per minute. Number 3 is true. Consistent aerobic exercise strengthens the heart, allowing it to pump more efficiently and can reduce resting heart rate significantly. This is going to be, we're going to see more of a lowering of the resting heart rate if we're less cardiovascular fit, right? If we're starting off with a lower cardiovascular fitness, start to really focus on our cardiovascular fitness and see improvements in our fitness levels, we should really see that heart rate come down. If we're already cardiovascular fit, we might not see as much of a change. So moving into this week's topic, the objectives, right? We just want to understand how exercise impacts cardiovascular health, identify key benefits of regular physical activity for the heart, and apply simple strategies to improve our heart health in daily life, our weekly daily routines. So starting off, what is cardiovascular health? Cardiovascular health refers to the efficiency and resilience of the heart and blood vessels in delivering oxygen and nutrients throughout the body. Kind of like what we just talked about in our number 2 question in our pop quiz. Key factors include heart function, right? Pumping capacity. If we can be a little more scientific, we would say cardiac output. We also see other key factors include blood vessel elasticity, which really helps play a role in blood pressure regulation. We can also see increase in capillary density, especially in those working muscles. If we're really focused on aerobic exercise, cardiovascular exercise, we can see an increase in capillary density of working muscles. All that leads to more efficient oxygen transport. So how does it actually improve our oxygen transport? How exercise helps our cardiovascular health? First, it increases the heart rate and blood flow during activity, right? So during an acute bout of exercise, some of the immediate effects when we start exercising, basically our muscles need more oxygen, more energy to sustain that movement. This signals the heart to pump faster and stronger, blood vessels to start to dilate. We're going to improve circulation to those working muscles. get more oxygen to those working muscles, remove that carbon dioxide, exhaling that carbon dioxide. Then over long term, right, our body will start to adapt to those acute exercise sessions. You can see if we're over the long term, we can really strengthen the heart muscle for better pumping capacity. We're going to improve our cardiac output through increased stroke volume, increased ejection fraction. We're going to improve blood vessel flexibility and circulation. Right, again, we just mentioned better dilation, more capillary density in the working muscles. All that's really going to help enhance oxygen delivery to those working tissues, to other tissues at rest. And again, all this can lower resting heart rate and blood pressure over time. And why does this improve cardiovascular health? Basically, the heart gets more efficient. The heart basically is able to pump more blood with less effort. We have more resilience. Our blood vessels remain more flexible, reduce the risk of hypertension. That's really something we all want to be focused on, limiting our hypertension. High blood pressure has been called the silent killer. We want to make sure we're having good blood pressure regulation. Certainly want to avoid high blood pressure if we can. We have metabolic capacity with better oxygen utilization, and it's going to reduce stress on the system. Basically, in short, exercise can improve the cardiovascular health because it repeatedly stresses that system in a controlled way. Our body's going to have to adapt, forcing those adaptations, which will allow oxygen delivery and blood flow to become more efficient. So I found a really fun illustration, infographic, kind of what that kind of reviews what we just talked about. Right, we can see an increase in life expectancy if we're regularly participating in aerobic activity, aerobic exercise. For meeting those key physical guidelines for Americans, right? We can see a decrease in all-cause mortality by about a third, a decrease in cardiovascular mortality, 20 to 40%. And some of the factors that kind of allow for this, right? We're going to see increase in response to insulin on that top right, a decrease in hemoglobin A1C levels, decrease in incidence of type 2 diabetes. In regards to hypertension, we're going to see a decrease in peripheral vascular resistance. Again, we talked about having the blood vessels be more elastic, more in tune to being dilation, more capillary density. All this is going to help decrease systolic blood pressure by 5 to 7 millimeters of mercury. We can see improvements in hyperlipidemia. We can see increase in HDL levels, a decrease in LDL levels, 3 to 10 milligrams per deciliter. We can see a decrease in plaque progression in regards to coronary artery disease. And in regards to heart failure, we can see a decrease in rate of heart failure hospitalizations by about 28%, a decrease in all-cause mortality in patients that already have had heart failure by 35%. Again, all this is going to help decrease that all-cause mortality by about a third. Right, so now we've covered, what is cardiovascular health? Why is it important for us to focus on? Now we want to think about how can we actually include aerobic exercise into our daily or weekly routines. Again, I want to highlight the key physical activity guidelines for Americans, which is 150 minutes a week of moderate intensity aerobic activity per week. Right, those guidelines also include 2 days of resistance training or strength training 2 times per week, 2 days per week. Obviously, this class is focused on the aerobic activity, right, the cardiovascular aspect. So really think about where you're at now. We want to try to meet these key guidelines. If weight loss is a goal, we can shoot to up to 300 minutes per week of moderate intensity aerobic activity, kind of like where the benefits are kind of start to wane off, or kind of the peak of the benefits. We also look at vigorous intensity aerobic activity. Right, so if something more, right, moderate intensity means a brisk walk about 3 miles per hour, getting our heart rate elevated, our breathing rate elevated from rest. We could still, like during a brisk walk, we could still talk to our walking partner, still carry on a conversation. We might have to take a couple deep breaths between sentences or between words, but we could still maintain a conversation. We could also aim for 75 minutes of vigorous intensity aerobic activity per week. With vigorous intensity, it's more of a run, more of a hard cycle, right? We wouldn't be able to maintain a conversation, right? We get a couple words out, but we wouldn't be able to maintain a conversation with like our workout buddy. So those are the two key guidelines we want to aim for. Again, we want to slowly build up to those key guidelines. And again, we can break activities into as short as 10-minute sessions as needed. 10 minutes is kind of the shortest we would suggest. Obviously, even if we can just do 5 minutes, that's better than nothing. But 10 minutes really allows our heart rate to start to become elevated, breathing rate to become elevated, hopefully potentially see some of those adaptations we just talked about. But again, be flexible. If we just have 10 minutes after a meal to go for a quick walk, fantastic. Maybe we have a quick break after lunch, quick break after dinner, we can get in a quick walk. Again, even if it's not 10 minutes, can we sneak in some activity? And I really want to highlight trying to have a variety of aerobic activities we're focused on, not always doing the same thing every day or every week. Can we get in a nice variety? So will hopefully help us stay consistent, also see a good increase in our cardiovascular fitness levels. Love the idea of brisk walking for everybody. I think that's something that we should all aim for. But can we have some other activities on top of that? Maybe we are cycling, maybe we're swimming, maybe it's things like yard work, raking leaves or working in the garden. Would not count riding on the mower if we're pushing a mower, maybe. But other aerobic activities, maybe we like to do like dance classes, like Zumba can be a really fun one. People really have fun with the Zumba classes. Again, it could be walking outside, could be walking on a treadmill, tons of other cardio equipment at the gyms anymore, right? Things like, just mentioned the treadmill, right? We have the rowers, the ellipticals, stationary bikes, both recumbent and upright bikes, other circuit training, right? We could do some body weight circuit training potentially without much equipment. So again, lots of different activities we can do for aerobic activities for our cardiovascular fitness. I did talk about the strength training twice per week. Not really the focus of today's talk, but it is part of those key guidelines. Just always like to talk about those. But again, really just think about what can we do to integrate exercise activity into what we're already doing. Look for ways we can move more during our day. Can we take the stairs, walk during calls, walk during those meetings where we're not going to talk? A lot of people have been using the walk-in pads anymore. Those could be sneaky as well. And maybe we can find a workout buddy. I think that's another fun one to have here. Someone to walk with or hold us accountable should really help us stay on track, stay consistent, see some benefits with our cardiovascular fitness. So today, with today's class, I did include a handout, cover some of the tips we talked about within the slides. I also included a heart healthy workout, a quick heart healthy workout on page 2. Hopefully this is something we can do and without any equipment, without going to the gym. So I try to come up with one that's, without any equipment, without any gym memberships. About 15 minutes, 10 to 15 minutes, just depending on what your level of fitness is or you're able to do at this time. Short warm up with a march in place, walk around. We do some arm circles forwards and backwards, maybe a few gentle shoulder stretches if we need to, maybe some hip stretches if we need to. The main workout, approximately 10 minutes. We got 4 exercises. We're going to spend a minute doing each exercise and repeat that circuit twice. But again, make modifications as needed. If you're only able to do the circuit once, that's totally okay. If 2 times through is a little bit too easy, we can do a 3rd time through. Minute 1, we're going to jog in place. If that's too tough, can we do a brisk walk or kind of a march in place? Minute 2 is body weight squats. If those are too tough, we could always do assisted body weight squats, right? Again, we could use, maybe the like a table or some armrests to help stabilize ourselves, right? Again, we're trying to be consistent throughout this circuit, right? We're not trying to do as much as we can to where we have to stop. We want to maintain our movement nice and rhythmically for about 10 minutes here. Keep that heart rate elevated. So we've got to pace ourselves. So can we do body weight squats? Can we do assisted body weight squats? If those are too tough, maybe we can sit in a chair and do knee extensions for a minute. Minute 3 is jumping jacks. If jumping jacks, again, we can make some modifications as needed. We can do a side-to-side step for lower impact. We could just move our arms if our lower body or knees are hurting. And then minute 4 is push-ups. Do those from the floor if we're really fit. We can do them from the knees if we need to. I would expect a lot of us to do them from the knees or off the wall or off the side of a desk potentially. And again, we can repeat that circuit twice for about 10 minutes, right? Take a break after those 4 exercises. Quick break, get right back into it, repeat that circuit twice. And then we're going to cool down with some slow walking in place, stretch some nice arm, leg stretches, take some deep breaths, right? We want to allow that heart rate to come back down, breathing rate to come back down. Again, this is just a quick and easy one we can do inside when the weather's not great without a gym membership. Speaking of gym memberships, we do provide fitness facility discounts. If you go to the discounts page through that My Baptist page, you should find some different fitness facility discounts. And we do have quite a few discounts in most of the major metropolitan areas. Just to wrap up today's class, some key takeaways. Really want to encourage you guys to focus on the aerobic exercise, aerobic activity, as it really helps strengthen the heart, improve circulation, improve our cardiovascular fitness. Again, as you could see in that one, if we're meeting those key guidelines, we can greatly reduce that all-cause mortality risk. Regular aerobic exercise is going to help manage our blood pressure, improve our resting heart rate, allow our heart to be more efficient. And as I mentioned multiple times throughout today's talk, we want to aim for 150 minutes of moderate intensity aerobic activity, as well as 2 days of strength training. Again, start small, be consistent. Small, consistent changes will lead to huge benefits on down the road. Just one kind of thing to do today, start today. We'll call to action, start today. Take a 10-minute walk after lunch or after watching our recording. Again, if you guys ever have any questions, need any assistance meeting your health and wellness goals, always feel free to reach out to Best Health. Here, our email and our phone number are below. But I really appreciate you guys attending our Heart Strong talk today. We'll have more Best Fit classes throughout the year. We're trying to do these at least quarterly, see how they start to go. Trying to have some fun topics each time. And again, just trying to promote fitness, trying to promote activity to help us reach our health and wellness goals. If you guys need anything, reach out. Hope you guys have a wonderful day.